Have you ever dreamed of starting your own podcast? Well, you can. It's simple, it's easy, and best of all, it's free. By going to anchor.fm, you can start your own podcast today and have your own show up and ready to go. Anchor's graphic user interface is user-friendly, and you get paid for your content by setting up a Stripe account. Go to anchor.fm. Again, that's anchor.fm, and start your podcast today. Welcome to the Living Healthy Podcast, where you can improve your quality of life by making solid and informed decisions. I'm your host, Eddie Randall. Welcome back to another great episode of the Living Healthy Podcast. This is episode 3 of season 2. I want to apologize for not having the episode out when I initially planned to. It's been some tumultuous events since December with the death of a family member and then another family member taking ill. So I do want to apologize for that, but things are looking up. That being said, thank you for joining me. Please grab a cup of coffee or your favorite organic snack, sit back, relax, and enjoy the podcast. Crohn's disease is a very, very unpleasant disease to live with. I've had many patients that have the condition and a coworker that had it as well. It can be a life-changing and debilitating disease. Learning about it has piqued my interest, so I decided to make a podcast about it. I hope to raise awareness about the disease and talk about ways to make life easier while living with the disease. Crohn's disease, IBD or irritable bowel disease, is a term used for a class of diseases that causes inflammation of the gastrointestinal tract. This inflammation can cause severe abdominal pain, anemia, cramping, diarrhea, very foul, smelly stool, and sometimes bloody and very dark, tarry stool. People with Crohn's often experience flare-ups where the symptoms can be very painful and sometimes they are life-altering. We all have taken a laxative at some time or another. You know that cramping that you may feel as the laxative works? Now just imagine that discomfort magnified to the point where you bend down in pain and are unable to partake in normal daily activities. This is only a glimpse of what someone who has Crohn's has to live with. Crohn's disease is unique in that it can leave healthy parts of the intestines in between diseased parts of the intestines. This is very interesting and thought-provoking, at least in my mind. Crohn's mostly affects people in their 20s and 30s and is fairly common. The disease affects men, women, and children. The CDC states that most people are diagnosed in their 20s and 30s and that at least 3 million Americans suffer from the disease. Aside from the symptoms I just mentioned, people with Crohn's can have anal fissures, anal fistulas, and perforations. These are conditions that are very unpleasant to say the least. An anal fissure is a tear in the lining of the anus. This can happen when passing a hard stool. Treatment can include medication, stool softeners, a diet high in fiber, and in severe instances, surgery may be needed. Anyone can get an anal fissure. However, people with Crohn's disease are predisposed to this. People with Crohn's can experience constipation and or diarrhea at times. The constant pressure of both conditions can lead to an anal fissure. An anal fistula, on the other hand, is sometimes caused by an infection in an anal gland. It is a gap that forms between the skin and the anus. When it comes to people with Crohn's, this can form when a sore in the inflamed intestine spreads and tunnels into tissue. Perforations can occur when the bowel continuously becomes inflamed. Eventually, the tissue becomes thin and the contents will go into the areas where it is not meant to go. This is a life-threatening condition that can result in sepsis and death if left untreated. Types of Crohn's disease. There are 5 types of Crohn's disease. The first type is Iliocolitis. It affects the end of the small intestine called the ileum. and it also affects a part of the large intestine called the colon. Iliocolitis is the most common form of Crohn's disease. IBDrelief.com states that half of all Crohn's cases are ileocolitis. Symptoms of ileocolitis include abdominal pain, diarrhea, fatigue, fever, weight loss, hematochezia, and cramping. In complicated cases, fistulas and bowel obstruction are common. Ileitis involves inflammation of the ileum. This condition starts off gradually and gets worse as time goes on. When people first start to feel pain at the onset of this disease, the pain is often confused with appendicitis. This condition has the same symptoms as ileocolitis, but severe cases sometimes include anemia and abscesses. Gastro-Duodenal Crohn's is a rare type of Crohn's disease that affects the stomach and the first part of the small intestine called the duodenum. Symptoms are similar to ileocolitis, but also include nausea, vomiting, loss of appetite, pain similar to severe acid reflux, as well as weight loss. In rare and severe cases, a patient may get a Gastrocolic Fistula. This results in feculent vomiting. This is exactly what it sounds like. Fecal matter backs up, and that is what you would vomit. Jejunal-ileitis is the fourth type of Crohn's disease. This condition is rare, but mostly happens in children. This type of Crohn's is described as having patches or areas of inflammation in the upper half of the small intestines called the jejunum. Symptoms are the same as with ileocolitis, but will usually occur immediately after a meal. Crohn's colitis is the fifth type of Crohn's and affects the large intestine. The symptoms are the same as ileocolitis as well. However, other typical symptoms of Crohn's colitis include abscesses, fistulas, skin lesions, and joint pain. In rare cases, the patient's eyes can be affected. Now, eye problems can happen with anyone that has any type of Crohn's disease, but a person with Crohn's colitis has a better chance of having eye issues. Doctors are not exactly sure why Crohn's affects the eyes, although it could have something to do with absorption of nutrients that can in turn affect other organs. After all, the stomach plays a huge role in immunity, and if the stomach is inflamed, the immune system could be altered and see healthy tissue as pathogenic. The Scientific World Journal has an article called Ocular Complications of Inflammatory Bowel Disease by Maddie, Grover, and Buttress. They state that although IBD affects the intestines, it should be looked at as a systemic disease because it affects other organs such as the eyes. Eye problems for Crohn's colitis include dry eye, episcleritis, keratopathy, scleritis, and uveitis. Keratoconjunctivitis sicca, better known as dry eye, can feel as if you have a grain of sand in your eye, and it causes redness, itching, pain, and burning. Episcleritis involves the inflammation of the white of the eye, called the sclera. Blood vessels in the episclera become inflamed and red, resulting in pain. Other symptoms include tenderness as well as itchy and watery eyes. Keratopathy can cause your eye to feel irritated, watery, and can also result in sensitivity to light. Scleritis is inflammation of the sclera and involves redness of the eye, watery eyes, burning, light sensitivity, pain, and headaches. Uveitis is inflammation on the inside of the eye and usually happens when your body is fighting off an infection. Uveitis is linked to autoimmune disorders like rheumatoid arthritis and AIDS. It is a serious disorder that can cause cataracts, glaucoma, and retinal detachment. Uveitis is inflammation within the eye, and there are several types. It can cause redness of eyes, pain, blurred vision, and photophobia. Skin problems usually affect 2 out of every 10 people with Crohn's disease. Those symptoms can include epidermolysis bullosa acquista, erythema nodosum, pyoderma gangrenosum, skin tags, Apthus Stomatitis, Pyoderma vegetans, and vitiligo. Epidermolysis bullosa acquista is a rare disease that causes blood or pus-filled blisters to form on your hands, knuckles, elbows, knees, and ankles. It can happen in response to minor trauma. According to rarediseases.org, this can happen to a person with Crohn's and can affect the hands, elbows, eyes, mouth, nose, and buttocks. This condition is related to other illnesses, including autoimmune disorders. On the U.S. National Library of Medicine, there's an article by Gupta, Woodley, and Chen called Epidermolysis bullosa acquista. They state that there are antibodies in both skin and the gut, and that Crohn's patients' inflammation may cause the response of inflammation to spread to the skin. Erythema nodosum is caused by inflammation and consists of round red bumps. In many cases, there is no known cause. However, in people with Crohn's, this condition can be triggered. People can have this on their arms, but it usually happens on the lower legs. Pyoderma gangrenosum. This consists of red bumps and blisters that can develop into ulcers. They can be very painful and the sizes can vary. Half of the people with this condition have Crohn's disease. Cancer and autoimmune disorders like rheumatoid arthritis can also cause this condition. They mostly form on the legs, although they can form on other parts of the body as well. Once they are healed, they can often leave scars on the skin. Skin tags are exactly what they sound like, little tags of skin that form that are often harmless. They can form anywhere, but often they form under an arm or in other folds of the skin. Sometimes they can cause discomfort, and when they rub against clothing, that is when you would really feel them the most. They usually start when excess collagen forms in between folds, rubbing on the skin. For people with Crohn's, they may have swelling around the anus from the disorder. In between flare-ups, the swelling may go down, and when it does, some of the swelling may also form flaps or skin tags. Apthus Stomatitis. These are small, round ulcers or sores that form in the mouth. The Mayo Clinic states that they form small sores with a yellow or white center with a red border, and they are painful and make it difficult for people to eat or drink. The sores can get pretty big, and half of the people who have Crohn's disease have this condition. Pyoderma vegetans is another skin disorder linked to immunity and Crohn's disease. The exact cause is not known, but it is known that it has to do with immunity. They are large and very painful sores that turn into ulcers on the skin. It often looks like a spider bite and then develops into a sore or ulcer. Disorders like rheumatoid arthritis and hepatitis C can also lead to pyoderma vegetans. Vitiligo is the loss of pigment on the skin, and people with Crohn's are predisposed to getting this disorder as well. This can usually appear on the chest, hands, legs, and back. Diseases like Addison's disease and diabetes are also associated with vitiligo. It's believed that Crohn's triggers a loss of immunologic tolerance to self-antigens, and that in turn results in vitiligo. I wanted to take a moment to say thank you for supporting the podcast. The Living Healthy podcast is listed on many platforms, including Anchor, Amazon Music, iHeartRadio, Google Podcasts, Spotify, Bullhorn, and many others. You can follow me on Twitter, Instagram, and Pinterest. And don't forget to check out the Living Healthy podcast channel on YouTube. Also, if you have any questions or would like me to discuss a particular topic, or you'd like to be a guest on the show, please contact me at livinghealthy@gmail.com. The etiology of Crohn's disease. For the most part, the pathology of Crohn's is unknown. What can be said is that there are certain factors that can predispose a person to getting the disease. Such things include the immune system, genetics, and environmental factors. Many people seem to believe that it's an overreaction of the immune system that causes the illness. The inflammation may be caused by an autoimmune response. The stomach, which contains both good and bad bacteria, has a significant role to play in immunity. Absorption of minerals, vitamins, and nutrients, as well as the pathways from the stomach to the rest of the body, are all an intricate part of the immune system. The GI system is a replete and complex set of systems that are not completely understood. The fascination, at least for me, is that Crohn's can leave healthy areas of the bowel untouched while affecting other areas of tissue that are at first just as healthy. Genetics are also thought to play a huge role, as with eye color, hair color, and facial features, Crohn's can also be inherited. MedicinePlus.gov states that there are some 200 genetic arrangements that are thought to change gene expression. When things like this happen, these influences can alter the body and systems within the body. Environmental factors also play a role, as there are certain things that can initiate Crohn's disease. This can be anything from contaminants in drinking water, exposure to toxic chemicals, and even pesticides in food. IBD versus IBS. I'm mentioning this because sometimes people use these terms interchangeably, and these terms are not necessarily the same. Although both are a pain to deal with, and both are life-altering conditions, IBD is far more serious than IBS. As I mentioned earlier, IBD, better known as irritable bowel disease, is a term used for a class of diseases that cause inflammation of the gastrointestinal tract. Irritable bowel disease includes ulcerative colitis and Crohn's disease. IBS, or irritable bowel syndrome, is a group of symptoms that impact the digestive system. Symptoms include excessive gas, abdominal pain, constipation, diarrhea, nausea, and various changes in bowel movements. As with IBD, the etiology of IBS is not specifically known. It does, however, share the theory of environment, genetics, and the immune system. IBD is more severe than IBS. Where IBD is a disease, IBS is a group of symptoms. IBD inflames the intestines, where IBS does not. In addition, IBD can increase your risk of colon cancer, where IBS usually does not. According to Crohn'sColitisFoundation.org, they state that IBD increases the risk of cancer and can cause permanent harm to the intestines. In contrast, they go on to state that IBS does not cause inflammation and does not increase the risk of cancer. Ulcerative colitis. This condition is also inflammatory bowel disease, and it is the inflammation of the rectum and colon. Although both have many of the same symptoms, ulcerative colitis differs from Crohn's in that ulcerative colitis affects the colon, while Crohn's can affect intermittent and deeper areas within the GI tract from the mouth to the anus. The Mayo Clinic states that ulcerative colitis affects the superficial lining of the colon and rectum, while Crohn's affects the deeper layers of the digestive tract. Symptoms of colitis include rectal bleeding, mucus in the stool, abdominal pain, unexplained weight loss, diarrhea, and fatigue. Testing. Testing is obviously vital in determining if a patient has Crohn's disease. Crohn's can mimic food allergies, IBS, and even colon cancer. Testing initially involves blood work, a stool sample, and imaging of your GI tract. Tests often involve, but are not limited to, an MRI, CT scan, esophagogastroduodenoscopy, colonoscopy, video capsule endoscopy, and chromoendoscopy. Blood tests can't really tell a doctor if you have Crohn's, but it can be used to rule out other things and pinpoint or at least lead to the correct diagnosis. As an example, if you have a heart attack, there will be proteins in your blood that tell that you've had a heart attack or some type of cardiac event. CBC, liver function tests, and electrolyte panels are also helpful in narrowing the margins to determine the specific illness. Stool samples can be tested for blood, infections, and parasites. Doctors will use magnetic resonance imaging, or an MRI, which will provide cross-sectional images to look for an abscess or fistula, which will help to determine if you have Crohn's. A computed tomography scan, or CT scan, can be used like an MRI to look for abscesses and fistulas. The difference between the two types of imaging is that MRIs can give more detail. EGD, or esophageal-gastroduodenoscopy, can be used to look for ulcers, bleeding, and abnormalities of the upper GI tract. Colonoscopies are so common as people who have a family history of colon polyps or cancer are often encouraged to get them. Everyone else, however, who hits 50 are encouraged to get one every 3 to 5 years. They're also a common tool in diagnosing Crohn's. A gastroenterologist uses a colonoscope to view images of the colon to look for inflammation, polyps, bleeding, and other abnormalities. Video capsule endoscopy involves swallowing a capsule with a camera in it so doctors can look at what's going on inside your GI tract. You would typically wear a small recording device that captures these images. This is done when other measures cannot find a problem like unexplained abdominal pain. Chromoendoscopies are mostly used to diagnose cancer. I'm mentioning it only because people who have Crohn's are at an increased risk to develop cancer. So depending on your family history and level of Crohn's disease, your doctor may order one. The gastroenterologist would spray a blue dye in the colon and it would highlight any abnormalities that may otherwise look normal under normal lighting conditions. Treatments for Crohn's. While there's no cure for this disease, there are treatments that can make living with the disease more manageable. Medications for Crohn's include steroids such as methylcortisone, prednisone, and hydrocortisone. These steroids can help to aid against inflammation. Immunosuppressants such as methotrexate can also be used to keep inflammation in check. However, immunosuppressants also increase your chances of other ailments, including cancer. Common antibiotics to treat Crohn's include ampicillin, ciprofloxacin, and vancomycin, which are used to treat abscesses and fistulas. TNF inhibitors, which are anti-necrosis drugs, are given by infusion and many patients get them. They include Entyvio, Humira, Remicade, and Stelara. Other treatments include liquid and soft diets for a duration of time to allow your bowels to recover. Although food cannot cause Crohn's disease, there are certain foods that can induce flare-ups and make your conditions worse. Sometimes an abscess, fistula, or perforation can form. When this happens, surgical intervention is warranted. Surgical procedures include abscess drainage, bowel resection, colectomy, fistula correction, and ileostomy. Abscess drainage is exactly what it sounds like and can be used if antibiotics don't work, or can be used in conjunction with antibiotics to make sure the area is completely healed. Bowel resection is when a diseased portion of the intestines has been inflamed by Crohn's so badly that it needs to be removed. A colectomy is a bowel resection where part of the colon is removed. In worst-case scenarios, a total colectomy is performed when the entire large intestine needs to be removed. Fistula correction is when the infected tissue is cut out and debridement is done to clean out the infected area. An ileostomy is where a stoma is made, which is a hole in the abdomen on the outside of the skin, and the small intestine is rerouted there and waste is collected in an ileostomy bag. FMT, or fecal microbiota transplants, are typically used for people who have C. diff. This is where excrement is taken from a healthy individual and made into a blend or paste and is placed into the patient. This is done in hopes that the good bacteria, or rather a good microbiota, will take hold and help the patient to heal or recover. Although doctors are divided on this issue, in some cases it can be an option for some sufferers of Crohn's disease. Crohn's disease and fertility. Crohn's disease can impact fertility in both men and women. This may be due to both men and women deciding not to have children due to risk of complications with the disease. In other cases, medications can put an individual at risk for infertility, particularly for males. Women are thought to be more at risk for infertility due to IBD medications. It more or less can cause inflammation of the fallopian tubes and ovaries. The main thing to do is to speak with your GI doctor and follow all directives and try to conceive when the disease is in remission. Food for Crohn's disease. Food for Crohn's includes food without insoluble fiber. Normally, I'm all for fiber in a diet, but for Crohn's, the fiber can make the illness worse in some cases. Quick oats, instant oatmeal, or 5-minute oatmeal is best as it has less insoluble fiber than traditional oatmeal. Yogurt is ideal as the probiotics will help the flora of the stomach. Bananas, peaches, and watermelon are also good as they can help with IBD symptoms. Also, canned fruit would be good as it contains less fiber than fresh fruits. Just be mindful of the sugar content in canned fruits as it is elevated. Sugar can exacerbate inflammation from Crohn's. Also, you need to keep a watch on your blood glucose to avoid spikes and avoid diabetes. On IBDrelief.com, they state that sugar is known to make Crohn's disease symptoms much worse. Fatty meats can make symptoms worse as well. Try lean meats like turkey, chicken, and lean beef. It's best to avoid hot dogs, pork, and ribs. Try to bake the meats, and if you have chicken, try to eat it without the skin. The majority of fat in chicken is in the skin. Fish like salmon, tuna, and mackerel are great for Crohn's. The omega-3 oil content can help to alleviate symptoms. Try to avoid fried fish sticks and beer-battered fish fillets. Other things that should be avoided are carbonated drinks like soda and salty foods. Don't hate me for this, but coffee should be avoided as well. Crohn's does affect people differently, however. There are some foods that can cause flare-ups in people with Crohn's, and other people with Crohn's can eat those same foods and experience little to no symptoms at all. So see what works for you and get to know your body when you have these foods. One thing to make sure that you do is to drink plenty of water. You also may want to eat smaller meals throughout the day. Living with Crohn's disease. Crohn's is a debilitating and life-changing illness, but that does not mean it has to control your life. Along with your gastroenterologist and PCP, you can take measures to live with the illness and manage its impact on your life. People with Crohn's disease have normal, long lives just like everyone else. There are just some adjustments to make. What else can you do to alleviate the condition, and is it curable? Some things you can do would be to wear loose-fitting clothes. Tighter clothes can put pressure on the abdomen and thereby worsening symptoms. You can avoid cigarette smoke or stop smoking if you already do. Not only does smoking cause inflammation in the body and harden arteries, it does make Crohn's symptoms worse. You can exercise as this strengthens your body, manages weight, and improves your immune system. Prayer, meditation, and yoga are also ideal in dealing with Crohn's. A hot bath or longer than normal hot shower may also help to alleviate symptoms as well. Is Crohn's disease curable? Unfortunately, Crohn's disease is not curable. At this time, the best we can do is to alleviate the symptoms through medication, diet, as well as some personal suggestions, which are the ones I just mentioned. Additionally, in worst-case scenarios, surgical procedures would be warranted. Well, that's going to do it for tonight's episode. As always, thank you for listening. Thank you for your support, and I'll see you next time. And remember, living healthy creates a better you.